In this case, we see a mass centered in the body of the left lateral ventricle associated with the septum pellucidum that demonstrates mildly hyperintense signal on the T2 and FLAIR sequence images, additionally with a mild degree of uniform enhancement on the post-contrast T1 weighted images. The leading differential diagnostic considerations in this case were central neurocytoma and subependymoma. Ultimately, this turned out to be a central neurocytoma. Central neurocytomas typically occur in adults and classically have a bubbly heterogeneous T2 hyperintense appearance with significant associated enhancement. These more classic features were not seen in this case, and these lesions can be difficult to distinguish from subependymomas on imaging. Subependymomas classically occur in older adults, have little or no enhancement, and with regard to location, most frequently occur in the fourth ventricle. Central neurocytoma usually has an excellent prognosis with cited survival rates of 90%.